Turmeric and curcumin, is it a bunch of BS? Welcome back to another part of our supplement education series where we look at supplements and supplement ingredients, some of the claims out there about them, and we see what the research literature has to say about it. Helps reduce occasional inflammation, provides antioxidant benefits, immunity and recovery, ease inflammation, relieve minor pain, support joint health, maintain body comfort, support healthy joints and brain function, promote cardiovascular health, help immune and digestive systems. Turmeric and curcumin sort of get used interchangeably, but turmeric is the root itself that curcumin comes from. A lot of different claims here, so we'll start off with this review from 2017, and then we'll talk about a few individual studies. This review describes some basic anti-inflammatory, antioxidant, and metabolic effects from curcumin, and perhaps some effects on brain function, although we'll talk about specific studies on that in a second. Notably, a lot of the research on curcumin is in people that already have some sort of a disease or condition, but there is some research also on healthy individuals, which we will get to. This was a 2010 clinical trial on individuals with osteoarthritis, looking at the effects of curcumin on things like osteoarthritis symptoms, pain, and inflammation. And after 3 months, those who took the curcumin supplement saw significantly greater decreases in their signs and symptoms of osteoarthritis as well as inflammation. For metabolic effects, this one's pretty wild. Basically, 240 people that had prediabetes, meaning that they are at risk for type 2 diabetes, either took curcumin or a placebo for 9 months. And after those 9 months, about 1 in 7 people with a placebo did develop type 2 diabetes, whereas 0 people consuming curcumin developed type 2 diabetes. Seeing that much of a difference makes you a little skeptical, but this was a randomized double-blind placebo-controlled trial, so it's pretty good evidence. Individuals undergoing coronary bypass surgery either had a curcumin-type supplement or a placebo right around the time of their surgery. And obviously these are not healthy people, but those who consumed the curcumin supplement had a 65% lower chance of having a heart attack during their time in the hospital. We're seeing evidence of positive effects in those that have something wrong with their health, but what about in people that are healthy? This was a simple 4-week study of a curcumin supplement or a placebo in healthy people aged 40 to 60. And those who consumed the curcumin supplement after 4 weeks ended up seeing positive effects in terms of anti-inflammatory measures, antioxidant measures, and this beta amyloid protein concentrations, which is a whole wormhole that you could go down looking into research on Alzheimer's. And there's not much for human trials on the subject, but some researchers do think that there are positive brain effects. It's a classic case of we can't say anything for sure right now, but it's reasonable to be optimistic. And curcumin appears to have a positive effect on the immune system, likely due to its anti-inflammatory properties. Also worth noting, piperine improves the bioavailability of curcumin. It's what's in black pepper, which is why you'll see this ingredient in a lot of these supplements. So are turmeric and curcumin BS? No. If you're a healthy person, it's not something that's going to make or break your health or performance, but you can expect to see mild health benefits.